Hello, my name is Alina Fong. I am a clinical neuropsychologist at my clinic, Cognitive FX. Here at my clinic, Cognitive FX, we utilize advanced neuroimaging to help with our diagnosis, but more importantly, help guide our treatment, because getting you better and giving you those resources are the most important part of this journey for you. So I may be a little biased and think that the way we do it is the best, but if you're already being treated for your concussion, these are some questions to ask your provider to see if they would be a really good fit for you. First of all, I think it's important to find a provider that is willing to do structural imaging, do a CT, do an MRI, and not push that off. Most of the time, a vast majority, your imaging will probably be normal. But we found we sometimes catch things that we would never have seen had we not imaged. It's really important to find a provider that doesn't discount what you're going through, right? You want a provider that will validate that what you're going through is real. So many of our patients will say that they were told they were crazy. You know, they felt crazy because everything would come back and it would be normal, and their doctors just didn't want to help them anymore. So please make sure that you find one that is willing to sit and listen to you. Thirdly, you would want a provider that is well connected in the therapy community. And so you definitely want a doctor who can kind of play quarterback and say, okay, based on this, I think you should see this type of specialist, and also, you know, a vision specialist and a physical therapist and maybe a cognitive therapist or an occupational therapist or even a psychologist sometimes. That is so essential. This multi-disciplinary approach is very essential to recovery. Another thing to consider in a good doctor is their view of medication and how it matches up with yours. There are lots of providers who would love to just write scripts and medications to try to treat the symptom. But oftentimes, these medications are really not meant to solve long-term problems. They're meant for very kind of short-term solutions. And often these medications have side effects that can exacerbate or make some of your concussion symptoms worse. And so if you do not want to do medications, make sure that you convey that clearly to your doctor, and that you have a doctor that's willing to say, okay, then let's try something else. Don't ever feel like you're forced into taking a medication. Lastly, it's very important to have a provider that knows when they can't help you anymore either, and can be honest with you about that. And sometimes it takes you asking your provider, is there anything else I can do, or should I start looking into other specialists? Most of the time, your providers are going to be general practitioners or pediatricians or even sports medicine doctors, but very rarely do you have someone that just specializes in concussion. They're usually seeing a myriad of other problems as well, and everyone has their limitations. And so for you to be able to have an honest conversation and say, okay, I think I've gotten this far, you know, can you recommend me someplace else, or are there any other options to try? I think that's really essential, is to find a provider that says, yeah, you know, I think I've done everything I can. Here at CFX, we take into account all of these things that I just mentioned, and we're backed by precise advanced neuroimaging. Again, that is my bias, but there are so many wonderful clinicians throughout the country and throughout the world that can help. But if you feel like you're still not all the way there, please feel free to reach out to us. Click on any of the links below to find out more information from our blogs, or to even contact us and set up a complimentary consult.